my channel, and for all those who are new out there, my name is Christine. You can call me Mrs. Awad. So today I'm here at Symphony Hotel here in Salmiya. I got an invitation for Cook Children's Hospital. So let me share to you a brief history about CCH, or Cook Children's Hospital. So this hospital originally started in Texas and is almost 100 years old now. So when they started, they only have 30 beds, 30 hospital beds, and from their humble beginnings, CCH has grown to become one of the largest and most recognized healthcare provider today. And the moment I received the invitation from one of the organizers, I never had hesitations about it. Because for me, as an aspiring mom, knowing the best healthcare provider is very crucial, because there comes a time in a child's life that she or he gets sick, and sickness is inevitable. And as much as possible, we will always choose what's best for our child. So like I said earlier, as an aspiring mom, it is always best to know my options beforehand, especially when it comes to choosing the best healthcare provider available. So today, I can't wait to listen to 4 speakers from Cook Children's Hospital and be able to know what kind of services they offer and what are the advantages and disadvantages.
I'm the director over the international program at Cook Children's. Has anybody here heard of Cook Children's? No. Okay. So we're located in Fort Worth, Texas. Have you heard of Fort Worth, Texas?
Yes.
Have you heard of Texas?
Yes.
Okay. All right. You've heard of Dallas?
Yes.
Yes. Okay. So it's Dallas Fort Worth, and if you've heard of the DFW airport, we're 20 minutes from DFW International Airport. So you have the airport in the middle, Dallas on one side, and Fort Worth on the other. So the metroplex is fairly large. Cook Children's is I think we're up to 445 bed medical center, pediatric only, and we have a very large campus. And we've got specialty center and etc. However, we also have over 60 neighborhood clinics and urgent care clinics. We're a very unique model in that everybody that is with Cook Children's is employed by Cook Children's. So that is an advantage in that, along with, we're not a teaching institution, and because we're not a teaching institution, our physicians and our specialists are the ones that are actually caring for the kids instead of, residents and fellows, etc. Although we do get, we do have, I'm sorry?
We have residents.
We do have some residents, but not very many. It's specialty by specialty, I guess. We have been in existence over 100 years. So Dallas and Fort Worth and Texas being as big as it is, the hospital was actually started by nurses back in 1918, I believe, and to care for the kids and to care for the maternity mothers, and it just kept growing and growing and growing to where now it is just it's a very, very large institution. It used to be called Fort Worth Children's, and we had a very generous donor, and so which you'll see here a little bit on the video, and so now we're Cook Children's.
Endocrinologist, and pediatric endocrinology is a specialty that helps children who've got problems with the hormones. And so, in big classification, that would be patients with diabetes, both type 1 and type 2 diabetes, which are the different forms of diabetes, patients with growth problems, so children with short stature or even children who are overgrown and too tall, children who go into puberty early or late, and of course the thyroid is a very common problem. So we would see a lot of children. We have one of the biggest endocrinology departments in the country, and inside our department we have doctors who are very specialized in different areas. So we have a doctor who specializes in diabetes, and I personally specialize in children with low blood sugars. And so, unlike in the adult world where lots of people feel like they have low blood sugars, in children low blood sugar diseases can be very serious. And in fact, they're so serious that they can cause brain damage. So it's very important to diagnose them early and quickly and to treat them appropriately. And so our program is one of the few programs in the world that does some special things to help us diagnose these children. And so we've had children come to us from all over the world. And in my department, I have a physician, Dr. Don Wilson, who's a world leader in cholesterol. I'm sure you're probably aware that adults who have problems with cholesterol can have heart disease and heart attacks. And what we've learned now is it starts in childhood. And it's very important for kids to have a healthy diet and to know if they're at risk for disorders of high cholesterol and to be treated. So endocrinology over the years has become a very wide specialty, helping children basically grow up and become healthy adults, go into puberty at the right time, end up the right height, and obviously the diabetes is a big problem.
Sorry, I'm just a little bit late. I was actually tied up over at the hospital visiting with some of the neurology team over there. So I am a pediatric neurologist. Neurology is the field of medicine that deals with problems of the brain, the spinal cord, the nerves, and the muscles. And my particular area of interest is in movement disorders and rehabilitation. Movement disorders covers a whole host of things. In young children, probably the most common thing we see are children with cerebral palsy or an injury to their brain that may occur either before, during, or after birth, depending on what the problem is. And it makes it difficult for them to move. There are other movement disorders that we see as well. Many of them are genetically based.
Look at who we are compared to all the other institutions that you look at. The physicians at Cook, I would say, probably come for the patients we care for, and we probably all stay because of the colleagues that are there. We all are fairly well trained, coming from fairly high academic institutions, and we choose to be in Fort Worth caring for the patients partially just because of the environment that it's in. And we all work together, and I send patients back and forth. I'll see a patient, send them back to Dr. Marks, please Botox this, send them back, let me see what they look like. And it really is a direct contact, which is much different than the layers of an academic environment. And I would argue we are very academic in our own, academic defined that we are not currently associated with a medical school or something like that, although we certainly are in some instance, and there is a new medical school opening in the city. But we are all there to take care of the kids that we take care of. It is an environment that's very interactive and very patient focused, patient care focused, and so it's a little bit different than some of the other environments that you may see as a hospital.
Bingo time.
You have nothing, so it's bingo time.
15?
What?
Get Get some good numbers, Glenn.
Yeah, exactly. Okay, let me try have the drum roll now.
Oh, there we go.
So it can
Yeah.
just be
Is
ver-
Guys, I'm home now and thank you for watching. If you like it, please give this a thumbs up. And for all those who are new to my channel, please don't forget to subscribe. Thank you for watching. Bye!